Hi, everyone. Good afternoon. This is Pat Ryan. Thank you for joining for our COVID update today. We're going to cover what's been happening in the 48 hours since our last update on Tuesday. To sum it up at the top, the last 48 hours have been the single worst 48-hour period since the beginning of the pandemic by pretty much all measures. And I really want to emphasize that if we don't start to flatten this curve now of the second wave, so once again, do what we did in the spring to flatten the curve. If we don't start to flatten that, this is going to be a very long and a very dark and a very difficult winter. And I know that is not what any of us want, especially as we know that there is some reason for light and optimism at the end. So once again, in the face of increasing data and evidence and health advice that the pandemic and the second wave is now definitively worse than the first wave, we need to collectively act, and asking everyone's help on that. In terms of what we're seeing by the numbers, total cumulative cases now at 3,718. We've tested almost 159,000. The vast majority have recovered, 2,475, and we are thankfully have not had any additional fatalities since our last update on Tuesday. What we have seen is a pretty dramatic, over such a short period of time, increase in hospitalizations. So on Tuesday we were at 8, we are now at 12, with 2 in the ICU. That is what we would predict and anticipate, that as we start to see the total case number go up, correspondingly we will see the hospitalizations go up, and usually that lags in time by a week or 2 or even 3. So of course we have concern, and we are projecting that those numbers of hospitalizations will continue to climb, and we are seeing that across the region and across the state and really across the country as we're setting records pretty much every day nationally for fatalities, for hospitalizations. And now here in Ulster County, the last 2 days in a row, we have set new records for active cases, and those are not obviously the records that we want to be setting. We saw in this 48-hour period essentially a 50% increase in our hospitalization numbers just in those 2 days. The other thing, of course, that we're seeing that I just alluded to is in terms of active cases, we are now well past the height of the most active cases we had in the first wave at 1,142. The highest we were at on April 26th, which you can see on the left of the graph. The highest we were at there was just over 1,000 at 1,006. So we are now well over that, and expecting that number to continue to climb, given that really we are most likely not seeing the impacts yet of the Thanksgiving period. And so based on all the science and health expertise related to that, we can pretty reliably anticipate that these numbers could go up dramatically given the gatherings that likely occurred. In terms of new positivity, this is also one of the highest numbers we've seen since the height of the first wave. In the last 48 hours, we have tested 3,061 individuals. So we're doing pretty well on testing. That's a pretty high number of total tests for us in that period. But out of that 3,061, we've had 220 new positives. So 48 hours ago, we had 99 new cases. 24 hours ago, 121. Those are both records for single-day totals, so 2 days in a row of seeing unprecedented numbers of new cases. And that puts us, for a 48-hour period, at a 7.2% new infection rate, 7.2%. Again, you can see it on that graph, and you'll remember that once we got through the first wave and got into the fall and even the early winter, we were holding at or around 1%, and we've dramatically increased now. And you can just see that very steep climb on this graph as well, of that orange line, unfortunately. Finally, where does this look like we're going in terms of cumulative cases? We've started projecting that out again. We are We are currently under 4,000 total cases, but all of our projections, including the most sort of lowest numbers, the best case scenario, still have us exceeding 5,000 cumulative cases by Christmas, which is just only a few weeks away. So once again, I can't stress enough how concerning and dire each of these indicators are, and when you bring them all together, we remain very concerned and really strongly urge everyone to take action. We're going to talk about what we're doing here and what I'd ask all of us to help on in a minute. Hospital numbers, we talked about current numbers, 12 currently hospitalized with 2 in ICU. Right now, we're good on need, but we have been coordinating with much more frequency with, on a daily basis now, with all of our hospital leaders to ensure that they're readying plans. The governor's obviously directed our hospitals to ramp that up, and they had already been doing that work. So we remain confident that we have that capacity now and going into the near and midterm, but we will continue to monitor that closely as we do start to see those hospitalizations tick up. So in the face of this and in the face of these concerning and numbers, I think it is easy for all of us to feel powerless or to feel our spirits dip and say, well, what can we do? It almost seems like this is out of our hands. It very much is still in our hands in terms of how quickly we can flatten this curve and ultimately how high the peak goes. We saw how that worked in the first wave. Once we all got our head in the game and we took these actions, we were able to flatten, but it also had serious second and third order effects. So now we're trying to get that balance right of smartly taking precautions and putting in place restrictions, but not doing it in quite as broad a way. So some of the things that we're doing to remain proactive, and I really think that is the key, is remaining proactive, ensuring that we're incorporating those lessons we learned and that we're adding in new techniques and strategies as well. So number one, continuing to expand our testing efforts. Was on the phone this morning with another one of our core healthcare partners, asking them to ramp up their testing. Everyone at every level, from our hospitals to our providers to our urgent cares, are really all doing everything they can to add more testing capacity. The honest challenge is that nationally, all of these systems are being stressed in a way that they haven't been at any point yet in the pandemic, because now, unlike the first wave where it was centered in New York and the Northeast, it is a national problem, which is creating all kinds of pain points in the supply chain of getting tests, of lab capacity, of staff to administer the tests. So we're continuing to ramp up those PCR diagnostic tests, and we're also hopeful that we'll have new testing products coming out soon that will make it easier for people to test at home, for people to be able to test more widely. Those aren't here yet, but we are hoping that they're coming soon and doing everything we can to push to get them once they are available here. The second thing we're doing is adding more staff capacity at the county level to ensure that we can more rapidly do the contact tracing that we need. We're now doing an unprecedented level of contact tracing. So we've gotten support from the state to add some more public health nurse and public health expert staffing resources. We may, in the near future, also put out a call once again for volunteers from the community to help with that. Plus, we're being supplemented by the New York State contact tracing folks, but they are beginning to get pushed to their limits as well. So all of these efforts are going at full bore, but we're testing the limits, and we may look at more creative strategies to add even more capacity. So more coming on that as soon as we have more details. Finally, we are doing the parallel planning on vaccine distribution so that as we begin to receive early doses, and more importantly, going into next year, as we receive wider scale amounts, we can rapidly get that out. We did hear the governor yesterday talk about the fact that in this first wave, New York State will receive about 170,000 doses. That's good news, but I want to really make sure we understand what that means here on the ground in Ulster County. So New York State has about 20 million people. We've got about 200,000 residents, meaning Ulster County is about 1% of the state's total population. So if you take that 170,000 number, 1% of that is 1,700 doses. Divide that in half because each person needs 2 doses. That means that in this first wave of vaccines, we'll, in Ulster County, have enough for really only a few hundred people. As we've heard, that will be prioritized to healthcare workers and possibly to seniors at senior facilities and staff there. So I want to set realistic expectations that the first doses we receive will not be nearly enough for any level of wide-scale distribution. So it's encouraging initial news, but we'll have a lot more work to do to make that widely available, which we think will happen deep into the winter, if not early spring. So once again, that means that we have to use the tools we have right now, which are masks and other precautions, to get us to that point. I want to share a little bit about, we have been getting questions about, so how is this being spread? What can I do in my personal life or at work to reduce that spread? New York City actually put out a really good study just yesterday, and we're still digesting this because we just saw it late yesterday, where they analyzed about 4,000 individuals from New York City and asked them a whole series of questions about how what their behaviors were that might have led them to be infected with COVID. Some of the high-level takeaways from that were that the predominance of transmission of COVID right now, at least among that group, were two main things. One were group get-togethers, group settings and gatherings, especially over 10 people, but really any time that you had larger groups getting together, whether at a home or at a restaurant, particularly, of course, if they're indoors, that was one of the biggest drivers. And the second was actually transmission, even in small numbers, from family and friends to each other unknowingly, where you have an asymptomatic person who may transmit. That is really, really hard to control, other than to say that I think we have to start thinking in the mindset, unfortunately, that we were in the beginning, where you almost have to treat most folks as if it's possible that they are symptomatic and act accordingly. And I know that we've all kind of let that loosen up a bit, and that is definitively part of the reason why we've seen the increased spread. So once again, getting back to those things we were doing in March and April and May, on the personal level in our homes and our places of work, that will be that is really the most effective tool we have. Of course, along with these masks, those are the most effective tools. The other thing that I wrestle with saying, but I think we're at this point. At this point, I think we're at a place again where really we need to encourage people to stay home if possible. If it's possible for you to stay home, particularly from a work setting, definitely from any social gatherings, and even really just leaving your home only for those critical needs that you and your family have, that is another tool. That's not being imposed or ordered, but that is something that really, if we each did that, it would have a dramatic effect. I know that there are, of course, consequences to that, but that's what worked in the past. And so we are maintaining a discussion with the governor and his team and the state about what may come with additional restrictions, the yellow, orange, and red zones. As I've said, we're not there yet, but we are definitely headed that way. And if we don't take dramatic action, we will definitively have more restrictions imposed on us. My hope is that we can start doing that work now to self sort of regulate, if you will, and do those things individually and as groups of folks. So that is where we're at. Unfortunately, it's not It's not good news, but it's news that we all absolutely need to hear, need to take in and take seriously, really getting our head back in the game. We talked weeks ago about a wake-up call, and I know many people heard that wake-up call. Many of, probably I think most of you watching heard that wake-up call, but some of your friends and family and coworkers, they heard it and they ignored it, or they didn't hear it. So we need to spread the word to make sure everybody hears it, and then we need to encourage each other and urge each other to take this seriously in the face of increasing and really very clear evidence that we're back in this second wave. As we navigate this second wave, as always, and it's even more important, I think, to re-up these things now. Don't forget individually to wear masks, maintain social distancing, and wash hands. Those are individual things we can do. The other thing we can do is please continue to thank all of our frontline workers who, once again, are at increased risk to themselves and their family to keep the essential parts of our society and our economy running. We thank you for what you're doing, whether that's staffing a hospital, getting food to folks, getting critical mail or other supplies to folks, keeping people informed. The only way we got through the first wave was together and also relying on these heroic frontline workers, and we're going to need to do that again. So thank you to all of you. As your concerns or needs grow, we are still here for you. We've been here throughout this. We're not going anywhere. We will continue to do everything we can to keep you informed and to try to meet all the growing needs that we have. A great resource, and really the go-to resource, is our Recovery Service Center. You can call them 845-443-8888. And our website, our COVID-19 website, and the address is on the screen, has a lot of this information, all of the case data and tracking information, but it also has resources for our businesses, for parents about school situation, for any of the other critical needs that you might have, all the details about testing sites and times and requirements. That's all on our website, so that is another great resource, our Ulster County COVID-19 page. Thank you to our whole team that's working hard throughout the county. Thanks to Radio Kingston, Diane and Manuel as well. As always, we will see you for our next update on Tuesday at 2 p.m. And until then, please spread the word about this, stay safe and healthy, and be resilient. Thanks.